had no insurance, and these people still took me on. It was really bad because, I mean, look at what I went through, man. I'm serious. I couldn't even hardly walk. You know, I barely taking baby steps. You know, my self-esteem was getting shot. But these people were telling me it's gonna be all right, Carlos. We're gonna make this happen. We're not gonna leave you like that. You know, we're gonna make this work. You know, and they did. It was awesome, just an awesome, you know, feeling that people do really care about you.
The specialty clinic grew out of a need for specialty care in King County. Up until the last few years, there was no place for a community health primary care physician to refer a patient for specialty care.
And the larger effort was really around how do you provide more specialty care, but also the continuum of care that's associated with successful specialty care. We tried to create a place, a view, a philosophy, an approach to these underserved people that would allow them to get the care they needed in a very responsible way. Certainly, the administration had faith in our efforts. Our foundation had faith in our efforts.
So we brought together the Swedish physicians, we brought together community health physicians and the clinics, we brought together Project Access.
The Swedish quickly saw the value something like Project Access Northwest could add to their mission by allowing them to see more patients more efficiently and spend less money doing it. The folks that we work with are all low income. Most of them are uninsured. They get their primary care in the community health centers, which do a fabulous job with primary care services. When those patients need access to specialty services is when they access a service like Project Access Northwest.
If you have bad oral health, it's a cinch that the rest of your health is going to deteriorate over time. And this was a real conundrum for us until we decided that we should have a dental clinic as well.
The dentistry program at Swedish started about 5 years ago when we started a hospital dentistry residency program. When the administration was building the SCSC clinic, they came to us and said, you know, we have a little bit of extra space. Would you have any use for dental services there? Would there be any way that we could incorporate that? And that got us to brainstorming, and we came up with the idea of an extraction clinic. The type of services we provide are often very difficult, complex extractions. So these are the ones that your average general dentist wouldn't feel comfortable doing in the community clinic system.
We tried to create something where everyone was a winner. The hospital is a winner because we managed to save $9 million in less than 2 years. $9 million in less than 2 years. By keeping folks from the emergency room and putting them in the right place of care. If you can find a way for all these parties to benefit, that not just social justice is sustainable, but Swedish is sustainable, and those patients who otherwise would be miserable, their health will be more sustainable.
From 2009, we had a handful of physicians who were helping us establish the clinic, and now we're up to 300 specialists within the Swedish system who either are available to consult in the clinic or they will do surgeries in the hospital. People started coming out of the woodwork saying, how can I participate?
The doctors are able to come in, do their consults or their procedures, feel like they have done what they were trained to do and love to do, and they're on to the next thing. We take the administration largely out of their hands. We provide the insurance, we do the paperwork, we provide the environment.
And every clinician that I've met with in Project Access went to medical school to help people. This clinic lets folks remember why and lets them just give back in a selfless, altruistic way that feels good in their soul.
I believe things like this specialty clinic are ways that we can represent real momentum, ways that we can represent success, ways that we can represent hope